Good afternoon, everyone. My name is Kim Bittner, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know that this call is being recorded and will be posted to the NCC COVID webinar page, usually within 3 business days. Many times we'll have the recording up on the webpage well before 3 business days. Let's go ahead and take a look at the agenda for today's call. Today, we are pleased to have Dr. David Van Wyck with DaVita Kidney Care. Our topic for today's call is COVID-19 versus the flu, breaking down the differences. So what's this call all about? You will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to use and share with others. And this series of calls is available to you offering a variety of topics. Now, before we begin, we have a few questions for those of you who have joined us on the webinar. And at this time, Matt, I'd like to turn it back over to you.
Great, Kim. Thank you very much. So we're going to open our first question here. And this is a question that's going to appear on your screen. And you just simply provide an answer, a true or false answer, and then click the submit button when you're done. You should see that question on your screen now. And this is a true or false question, as we said. So true or false? You do not need to receive the flu vaccine this year because it does not protect you from getting COVID-19. Is that a true statement or is that a false statement? Just go ahead and select one or the other, either A or B. The important thing is once you answer, make sure you click that submit button so that we know that you have answered the question and we can record your result. Now, we're not tracking individual results here. You're not being graded. We're just trying to get a sense of what our group here today feels. So Kim, we've got 3 or 4 in progress here, and I'll give them about 10 seconds more or so. Oh, it looks like we might be done. So last call to get your answer in. If you'd like to answer, go ahead and select true or select false, whatever you think the correct answer is, and then click that submit button when you're done. All right, and we'll close this in 5, 4, 3, 2, 1. Okay, so we've got 73 responses here. Kim, let me share the results with you, and you can see what our group here thought today. You see that on your screen?
We have that up there. Thanks, Matt.
Sure. All right, and would
so
you
we
like
have.
Go ahead.
Oops, yeah, go ahead. Keep going, Matt.
Sure thing. So we have a second question here, and we'll open this one as well. Same concept, true or false. Just pick an answer. And this one says, true or false? One symptom of COVID-19 is a loss of taste or smell. Is that a true statement? You'll select true and click submit. If you think that's a false statement, you'll click false and push submit. So now that we're familiar with how these polling questions work, the answers are coming a little bit faster. So go ahead and make your choice if you'd like to participate. True or false, one symptom of COVID-19 is a loss of taste or smell. And we'll leave this one open here for about 5 more seconds. So be sure to click that submit button if you've made a choice. We'll do that in 5, 4, 3, 2, and 1. So let's go ahead and we'll close this polling question. Oh, got a couple of last-minute answers sneaking in here. So this one might take a second to tally the results, Kim. Sometimes WebEx needs a little extra time to think, as we all do, don't we? But the results are overwhelmingly, I'll just share them verbally with you. 100% of our folks online today said true. That is a symptom of COVID-19. And I'll share that with you here in a moment as well.
Well, thank you, everyone, for participating in that. We do appreciate that. It just helps give us a little bit of information as to involvement with your knowledge related to COVID-19 and the flu. So at this time, let's begin with our presentation. I can go ahead and have the next slide. So let's go ahead and skip this slide, Matt, and the next one. There we go. So as our speaker goes through his presentation and you have any questions, please go ahead and submit them in the chat feature through WebEx or on the Q&A on the lower right of your screen. And then when we get to the question and answer section of the presentation, we will share those questions with our speaker, and our goal is to answer as many questions as our time allows. So let's go ahead and learn a little bit more about our speaker. As I mentioned earlier, we are pleased to have Dr. David Van Wyck. He is the Vice President of Clinical Support Services at DaVita Kidney Care, and he serves as the Physician Executive for DaVita Patient Safety Organization, and is also Emeritus Professor of Medicine at the University of Arizona, where he received his medical degree and completed his residency and subspecialty training. Dr. Van Wyck, thank you for joining us today.
And it's a pleasure to be with you today. I have been working in infectious disease. I'm a nephrologist, but I had an interest in infectious disease that goes back at least 50 years. And that's probably how I found myself in the position of leading the infection control group for DaVita and being part of the COVID response team as well. What I want to do today is to give you some basic ways to understand how we think about influenza and COVID. We are now into the flu season, and vaccination for one of those viruses is available now, and vaccine for COVID is under development. So it's a great time to be talking about these issues. I think what I'd like to do is if you advance to the next slide, is give you a really simple way, which is the way I think about it, about how these viruses work. So in general, a virus is just a sphere, like a sports ball, with a thin lining on the outside, and on the inside, either DNA or RNA to code the stuff that it needs to work. And really all a virus does is get inside the cell and break apart, and then use those coding devices to replicate itself, to make photocopies of itself that then get extruded from the cell and circulate around and reinfect elsewhere in the body. So a respiratory virus is just a little bit different from that because, first of all, it's got to stick. It sticks on the respiratory surface of the back of your throat and down into your airways. So let's have the next slide. So coronavirus and influenza virus are both respiratory viruses, and they look more like a tennis ball on the outside. They have this hairy look with loops of stuff that is attached, really firmly attached to the surface. And just as that makes a tennis ball different from every other kind of sports ball, this is what makes a respiratory virus different from non-respiratory viruses. Here's the next slide. Slide 9. Thanks. So many of you will know what you're looking at here. This is Velcro. The hook and loop labels are misplaced here. They should be reversed. But the virus is that hairy tennis ball and blow up. It's just loops. It's just things that can get caught on the respiratory surface. And on the respiratory surface, that the back of your nose nose and mouth and down your airways into your lungs, those surfaces are lined with hooks. The loops are different for each virus. The hooks are different for each virus. But in general, that's how they stick. And when they stick hard. So, and that's important because in that sense, that answers the question, begins to help you answer the questions. How are influenza and SARS-CoV-2 viruses similar? Well, that's how. So next slide. And now that we've covered the outside, which is that hairy tennis ball in a Velcro situation, we can answer what's in the inside. And what's in the inside is something called single-stranded RNA. I think the best way to think about RNA and DNA is it's kind of like if you had all the dinners and all the meals that you've made in a year, and you needed a cookbook for all of that. That's DNA. DNA is all those recipes in a book. RNA is just a recipe for one of those dishes. And RNA for a virus is a very simple recipe. It's a very, very simple recipe if it's single-stranded RNA. And what that means is, if you took all of Thanksgiving, it might be the recipe for the gravy, something like that. It's a very simple piece of code, but it does what it does really efficiently. It makes photocopies of itself, and both the lining of the virus and the hair around the virus and more RNA, and when those things are put together, they get out of the cell, and then they circulate and infect other cells, and that's what makes you sick. There's another thing about single-stranded RNA that's a real beast for both influenza and COVID-19, and that is that they tend to mutate. So for a while, it's making regular bland gravy, and 2 months later, somebody's got jalapeno in their gravy. And that's what happens to both influenza and COVID. The next thing that's true about these viruses is they come from animal reservoirs. Influenza, you'll remember the swine flu and reference to that, 1957, but more recently in the 2009 novel H1N1 pandemic, that also came from swine and other domestic animals, it looks like. But seasonal influenza generally comes from poultry, from Southeast Asia, for example, often from Southeast Asia. And so those viruses are deep in animal reservoirs. Where they are, these rogue photocopiers that are changing the text on the photocopy randomly until those random changes make them more infectious to human beings. And then they jump from the animal reservoirs into the human communities, just as SARS did, just as the swine flu did in 1957, and just as novel H1N1 did in 2009. And now they're deep in our communities. And we get seasonal influenza every year, and we have now permanently have SARS-CoV-2 virus in our community. SARS-CoV-2, by the way, is the refers to the virus itself, whereas COVID-19 refers to the disease that happens when you catch that virus. So those are the big similarities in influenza, and just as influenza is going to be here forever, and we don't expect to eradicate it, so with SARS-CoV-2 and COVID-19 disease, we don't expect to eradicate it. We just hope to be able to control it with mitigation, with behavior, with public health responses, with vaccines, and hopefully with drugs that can decrease the severity of disease. Next. So, how are they different? Compared to seasonal influenza, seasonal flu, COVID-19 it's more infectious. It's substantially more infectious. If you get the flu, you'll transmit it on average to fewer than one person. 10 people getting the flu will transmit it to about 15 people, whereas on average, COVID-19 is transmitted from 10 to more like 25 patients, other people, and so there's that. But then, and it's pretty obvious that COVID-19 causes a much more severe disease than influenza in general, and of course, it's much more likely to cause fatal disease. It's more likely to cause death, and we'll come back to that. But that's the big difference between the two of them, and in terms of how they work in our communities now that they are both deep in our communities. Next. So how then can you avoid the flu and COVID-19? So let's break that down one at a time. And the things you can do to prevent seasonal influenza, things that you can do to prevent COVID-19, and then things that you can do to prevent either flu or COVID-19. This sort of the things that work for both. And for flu, overwhelmingly, it's get vaccinated. And we'll talk about vaccines for flu, but there is a vaccine available. It's available every year, and it's out there to be used. Use it, absolutely. COVID-19 is you want to avoid the super spreader events, the big burst conditions. These are ways in which COVID-19 really works different than flu. I think most recently you saw what happened at the White House. That was a super spreader event, and there's plenty in the news. But to understand how those affect communities, it's really important. So Maine, for example, a state that instituted quarantines and restricted travel into the state, and really had a very well-controlled system until there was a wedding in Millinocket attended by 100 or so folks with no precautions, and one of them was infected. And from that one came infections of many of the other 100. But now, because after the wedding they dispersed from this very small island on the coast of Maine and went back to their communities, now each of those communities now has virus in their communities. And Maine, which had been seeing maybe 10 or 11 cases a day, are now seeing 60 a day and rising. Because it's so deep in their communities, it's much more difficult to control using the same measures. I think the worst of that big burst stories is a city in South Korea in which one person who was infected at a large church started a series of infections which ended up with 5,000 infections in that city, and one person was responsible basically for all of that. That was a super spreader event. What characterizes all of those super spreader events is four things. Prolonged contact, being together for more than 15 minutes. Poor ventilation. The air doesn't circulate, and it's not refreshed with new air from the outside. Crowding, so proximity as well as prolonged. So it's close and prolonged. And then one highly infectious person. And people are most highly infectious, unfortunately, about 2 days before and the first 2 or 3 days after getting symptoms. And that's bad because you can't tell who's got the virus. You can't tell who is highly infectious by looking at them or asking them, are you infected? Or, in that pre-symptomatic phase, taking their temperature because they will look and act well, and they'll be highly infectious. So that's the super spreader events. That's the big burst. And whatever you do, avoid those conditions. Then there are the things, of course, that you do for both flu and the COVID-19, and you just practice the basics. It's incredibly simple. It's incredibly effective, but it's effective only if it's done, and that's to wear a mask in public places, maintain distance, and wash your hands. And it is so simple, and it's so easy to get fatigued, and it's so easy to think, I know who is sick and who isn't sick. It's so easy to say, well, I've let down my guard today. I let down my guard yesterday, and I'm not sick. I let down, I've been 6 months into this, and I'm still okay. I haven't gotten it. I can let down my guard a little bit more. And that's, the virus doesn't really care. The virus cares about those conditions: prolonged contact, poor ventilation, crowding, highly infectious. Be careful. Next slide. That lead us to why getting the flu vaccine is so important. I have to help you understand the pieces of this graph, which is taken from a brochure that is a that is released in medical news, released by the CDC on a weekly basis. And from their website, you can see this one. And so down on the bottom is the week of the year, and the week of the year they're counting. And they count for 50 weeks a year, start at 1, which is January, and ending at 52 in December. And the white, alternating white and gray, are different years, with the most recent gray there over on your far right hand is this year. We're at about week 40 right now. This is the 2019 to 2020, and then the beginning of the 2020 to 2021 flu season. The black lines are the percent of all deaths in our communities in the U.S. that are due to either pneumonia on the one hand or known influenza on the other hand. And you see that follows a wave-like pattern that peaks in the winter season and is at its trough in the summer season, and then just like clockwork, year after year, goes up and down. On top of that expected seasonal pattern are the patterns of the differences in influenza that year, and that's the red line. And except for the last panel, in which the red line includes all pneumonias, of course, so it's pneumonias due to COVID, and these are deaths. So 2 years ago, we had a pretty nasty round of influenza in which the deaths related to pneumonia and influenza were higher than expected. But last year, they were lower than expected until COVID hit. And then total deaths to pneumonia and influenza went up, they went down, they went up again, and they went down. And what we are about to see is probably the third spike this year in that pattern. And that is why you want to get a flu vaccine, because you don't want to be part of the preventable death or serious illness that contributes to the expected seasonal pattern or those year-by-year variations, because it definitely is. Influenza definitely can be fatal. It definitely can cause severe disease, and it definitely can cause hospitalization. So next slide, thanks. So specifically, how does the flu vaccine work? At the first level, it protects you against infection, but that is probably the thing it does least well and the thing that's least important to you, oddly. I mean, it's not intuitive. But instead of preventing infection for you in the way that, say, a measles vaccine would prevent infection, influenza vaccine is beneficial mainly because it protects against serious disease. You might get influenza this season after being vaccinated, and you might say, well, it failed this year, but it's not a failure of the vaccine. The vaccine saved you from serious complications of infection. I pause there because there's another dimension to vaccination, which is so terribly important for ultimately for both of these diseases. If this virus is in our communities, if it is deep in animal reservoirs, if it is a single-stranded RNA that mutates and changes as part of what it does, then and if it has serious complications for some or many, then what we do when we vaccinate is to prevent disease in others, to prevent transmission in others. And for influenza, that's particularly important. Even if the influenza vaccine is not particularly effective against a particular type that's circulating that year, you'll hear things in the news. Oh, it's ineffective against 50% of the viruses that we have circulating this year. It doesn't match. That is not correct. If 90% of the population is vaccinated, then you get 100% of the population benefit, of the protection of the group that you could get from even the best vaccines. So even the least performing flu vaccines perform extraordinarily well when 90% of the population are vaccinated, which is why, I guess the way I would see it is, in my family, I would expect 100% of us to be vaccinated. And the people that I'm around, family, friends, and coworkers, who might expose me or I might expose them, to block transmission within my group, I would want 90% to be vaccinated. The same is true for church or for any social gathering. So that's population protection. And if I just stop there and didn't say another word today, the one word that I would say is vaccinate. Get yourself vaccinated. Get your friends, your family, your coworkers, the people that you're in touch with, get them vaccinated for your protection, but also for theirs. And that's why we vaccinate. We vaccinate for the same reason that we wear masks. We do it to protect ourselves, but we'll mainly do it to protect others. Hope that's really clear. Next slide. So, symptoms of the flu compared to those of COVID-19. The two viruses share a number of symptoms. They're symptoms that are true for most respiratory viruses: fever, myalgias, which is muscle aches, cough, sore throat, runny nose. This is the symptoms of upper respiratory infection. Shortness of breath, that's lower respiratory tract. That means something's wrong with the lungs. Headache, weakness, and fatigue. So somebody with those symptoms, you can't tell whether they have flu or they have COVID-19, or even whether they might have both. Very specific for COVID-19, however, are the loss of taste or smell on the one hand, and diarrhea on the other hand. Really not clear how that happens, but if it does happen in a patient, that really does point you to the diagnosis of COVID rather than flu. So, what about the more dreaded complications? Let's have the next slide, which is our last slide. Both the flu and COVID-19 as respiratory infections can cause viral pneumonia, not just an upper respiratory infection or you're feeling bad, but an infection of the lungs themselves. And that shows up on as X-rays or on CT scans. And it shows up as shortness of breath. You saw that in the president, for example, those pictures of how short of breath it was. That's pretty typical. Then there's viral pneumonia, which is complicated by fluid in the lungs. And this is more than just shortness of breath by a lot. This is often related to how strong the immune response is, and somebody who is well and has few risk factors can have a very rapid response to the virus, and that it's that rapid and very aggressive response, protective response, which actually makes the patient sicker. And that can kill in influenza, and it can kill in COVID. Among the 40,000 people a year who die from diagnosed influenza, that's a common mode of death. Is the lungs just fill up with fluid because the immune response has been so fast. And that's what's so hard to explain to parents of kids or young people who are watching their child die of influenza. How could this be? It's not such a serious disease. Well, it is, and it's not rare. Then there's viral pneumonia complicated by bacterial pneumonia. Our airways are built so that they, all the time, 24 hours a day, are moving sputum secretions that are important for protecting the airways, and getting that regenerated means moving it up so that you can spit it out or swallow it. And mostly you're not even conscious of that, but that happens all the time. And it happens because there's little cilia, little fingers that move it directionally up and out. When you get a virus, you kind of paralyze, you make those cilia sick, and you make them weak. They can't move the sputum. The sputum gets plugged down there with all the bacteria that's in it, and the bacteria begins to grow. And when the bacteria grow in your lungs, that causes a secondary bacterial pneumonia. It looks just like a pneumonia that you would get at home, except it can be very, very serious and destroy a lot of lung. And that's how influenza patients die, and it can be how COVID patients die. And then there's, and you've probably seen this in the news, is that infection increases the risk of death in people with heart disease or lung disease. So they can be, they can have a relatively innocuous course from the illness that itself, and they get over COVID, but weeks later they may die as their heart disease worsens or their lung disease worsens, and that makes it in sort of doubly lethal, because if it doesn't kill you in the first round, it can kill you. It can kill by delayed complication. COVID-19 has one set of bad stuff, which is a multi-organ failure, so acute kidney failure, heart failure, CNS disease, brain not functioning well, and clotting. The blood wants to clot, and so it forms clots, and can throw those clots to the lung and make things really very serious and complicate treatment. So those are things that are specifically for COVID-19. Well, I've been talking for a long time, and we've covered a lot of ground here at a fairly high level. I hope that you have some questions that you'd like to answer. If you want me to go back over something in more detail, I certainly can do that. But I'm here mainly to help you understand these two diseases and what we can do.
Thank you very much, Dr. Van Wyck, for sharing both your experiences and your expertise. We definitely appreciate this very informative presentation. And before we take any questions, and we do want to remind you that if you have any questions, please submit them through the chat or the Q&A feature, so you have time to submit those questions, and we have received a few of them. We do have one last polling question. So those of you that have joined us through WebEx, get ready for another polling question. And at this time, I'd like to turn it over to Matt again.
Absolutely, Kim. And the good doctor has done such a wonderful job explaining the importance of the flu vaccine this year and getting that vaccine. So our question is simply a wrap-up of our previous two questions, which most of you got correct. And the question is this: after today's presentation, is your knowledge about the importance of getting the flu vaccine this year stronger? There's some very compelling facts that were presented here, and common sense things as well that were presented. So we hope that you will answer this question yes, and answer it honestly. I do see a good number of yeses coming in, so we're very happy to hear that. And we'll leave this open for a few more minutes. This is simply a wrap-up. And by the way, folks, when we asked the question to begin this event today about is the loss of taste and smell a symptom of COVID, true or false, 100% of you got that one correct. So we're very impressed with that answer. We'll go ahead and close this wrap-up question out. And you can see we've got virtually everybody said yes, their knowledge is stronger. So, Kim, I'll hand it back to you. And I just want to thank the doctor as well for such a compelling presentation today.
Okay, appreciate that. And let's go ahead and start with some of our questions. We have one that came in. Is it advisable to get the flu vaccine twice to make sure we are protected this year and the start of next year?
Yeah, thank you. That's a question that's often asked, and it's not settled. What we know for sure is you don't have to, what we know is that people who are vaccinated once tend to have the same level of protection throughout the whole season, all the way through March. So we recommend, and the CDC recommends, getting your influenza vaccine as early as possible, September if possible, October if not, and then one vaccine all the way through. They've consistently addressed this question, and they said that it's just insufficient evidence to recommend a second vaccine in, say, January. Now, having said that, there's probably no downside. There's no risk if you had a second vaccine. It won't hurt you, but it doesn't seem to help.
Okay. Thank you very much for that. And we have another one. Will you prefer the nasal flu vaccine or is an injection still the best?
Well, you can't see me because I'm not on video, but I'm 71, so I get the high dose influenza vaccine because I'm 65 or older, and that is available only through the IM route. I think the standard vaccine is, of course, also IM, and that's for anybody less than 65. The nasal vaccine is one which has been recommended in the past for kids and people who can't take an IM injection, people with blood clotting diseases, for example. But there's nothing special about that. So to make sure that I get the vaccine and I get it on time, I just go for the IM. Even and did that when I was less than 65. Hope that helps.
I think it does. And follow-up to that question, we received one. Can dialysis and transplant patients take the nasal spray?
So the nasal spray, in general, the answer is yes, but you need to get okay from your nephrologist or if you're a transplant, from your transplant team. If you have a transplant and you're immunosuppressed, my guess is that they will recommend IM, and that's what we do, and for most patients in the dialysis community who are home patients or in-center hemo patients. The reason is, and my guess is the reason it was brought up is that the nasal spray has been an attenuated virus, and attenuated just means weak. but weak in somebody who is immunocompromised is something that could cause an infection, and that would be bad. So in the past they haven't been recommended for certain groups. Those recommendations have changed a little bit, but I think if you are immunocompromised, not just on dialysis, but immunocompromised, like a transplant, or you are taking immunosuppressive medications for a medical problem, I just absolutely ask your doctor about it first before you get the nasal vaccine.
Okay. And we have, thank you for that, and we actually have two related questions to traveling. One individual asked, is it safe to travel now internationally? And another patient has asked, I am a dialysis patient, should I not travel by airplane or train? So I thought we might be able to combine those.
Yeah, what a great a great question. And actually, as you point out, it's a set of questions. So if I wanted to travel to Denver from Tucson, Arizona, where I live, I could drive for 12 hours. And really the only risk that I would have is I don't like to drive for 12 hours. I like to drive for 8 hours at the most, and then I need a hotel, and I'll sleep. So I would be exposed maybe at the hotel. But otherwise, I could keep my distance from everybody and be sure of my surroundings and not get into anything close to a big burst kind of situation or transmission situation. If I want to fly, everything's different. Starting when I get out of the car at the Tucson airport, walk through the TSA lines, wait at the gate and crowded waiting areas, and then get on the plane. And all of those areas are crowded, and all of those areas are subject to transmission at some level, non-zero level. If everybody has masks and it's compulsory, it's mandatory, that's good. That's a benefit, but it's still a non-zero a transmission rate before you get on the plane. The plane itself is pretty safe, but if you wear a mask, the ventilation is from above and the return is from below. So if you sit under that ventilator, open it completely so that you're getting air flowing down past you, and aim it at your face. It gets filtered before it returns, and it gets refreshed with outside air. So here to Denver, pretty safe just doing the flying. But then I get off the plane, I got to go through the airport, and I got to go out, and I got to pick Uber, rental car, or train to get to see, say, my kids in Denver. And all of those present unavoidable contact problems. Probably the safest of all of those is the train. But that's just statistically. And now you say, but I asked you about traveling internationally. So if I've traveled from here to Mexico, that's a half-hour flight, not a problem, but it's international. If I travel from here to England, say, that means flying first to Denver or Dallas or Newark, and then the Atlantic. And that's a lot more exposure in an airplane. And my recommendation is don't do it unless you absolutely have to.
Okay. All right. Well, thank you for that. We also, now this one it's related to with the holidays coming up, and it might be a little, slightly might piggyback onto the traveling and how much you want to risk exposure. But this question is, with the holidays coming up, my family wants to spend time together. What can we do to avoid the flu and COVID-19? This might be on a lot of people's minds.
Yeah, it sure is. It's been on mine, been on ours, our family. Unless it's a very simple family situation in which both families can basically quarantine for 14 days and not be in any exposure situations. In other words, work remotely at home or be retired or even unemployed at home, where you absolutely can confirm that you haven't been exposed to anybody else, then families congregating together present risk. And for all the reasons that we've been through, if one person has to work, has to go into work and gets exposed at work, they won't know for up to 14 days whether they're going to get the disease, and they can have the virus and be transmitting the virus even when they look normal and act normal and have no fever. And that's why the recommendation is to avoid family gatherings, even for Thanksgiving and Christmas, and the holidays in general. That is one of the most painful things that I think we have to face this year.
Definitely. Absolutely. Very, very painful indeed. Another question, what is your opinion of using UV light on our hemodialysis clinics as means of disinfection?
Not necessary. The cool thing about dialysis is that even before COVID, the disinfection practices were really very high level and were far better than those in the rest of the healthcare system and in general. It's just part of the practice because preventing viral transmission within facilities is kind of one of the cornerstones of safety in dialysis, and has been for the 50 years that I've been doing this. So it's not necessary, and it's really complicated. They're devices that only cover the surfaces that they irradiate. There's a much easier ways to disinfect those surfaces, and I think that's the simple answer. It's just not necessary.
Okay, thank you for that. And they said thank you as well. We do have time for one more question. This one may be a little bit of a tough one, but it gives you an opportunity to share your thoughts. The individual asked about the challenges with the number of COVID cases in the U.S. and if you would have just any suggestions for the overall improvement to the COVID-19 cases within the U.S.
Yeah. The simple things are the most important. So, mask, distance, and wash your hands or sanitize your hands, and do that 100% of the time when you're outside of your house. do that. And it's weird. The pandemic is so big, and the disease is so complex, and the information that we're getting in it changes so fast, it's hard to keep up. But buried in all of that, at the very core, the simple things are the most important. And the remarkable thing is they work. But they only work if we do them, and you do them all the time, because if you don't do them all the time, they can't work when you're not doing them. And that's a lesson this country has learned over and over again, and really the world has learned over and over again.
Thank you for sharing that with us. I think that's a great place to end this. I think that was a wonderful summary, and we, again, appreciate the very informative presentation that you provided us today. Thank you very much, Dr. Van Wyck.
My pleasure. My pleasure. It's been a privilege. Thank you for all the work you do for the community.
Thank you. And if we could have the next slide. There we go. So we wanted to share with you a few COVID-19 resources that are available through the NCC website. We provided a few links for you up there, and as a reminder, this presentation will be available on the NCC website on the COVID info, kidneycovidinfo.com webpage. You'll be able to access these easily through the PDF version. Obviously, we have some just where to find credible information, 4 ways to empower yourself to cope with COVID-19, multiple ways to connect with others during COVID-19. We encourage you to check back on this webpage frequently, because we are continually adding new resources on a regular basis. Next slide. We also, one of the resources that we like to share with you is the telemedicine toolkit, or rather the that's correct, telemedicine patient toolkit. This is the Kidney Patient Care, Your Guide to Using Telemedicine. It gives you an explanation of what is telemedicine. It offers tips of benefits of how to use it. There is also a resource in the back to help with your visits, to keep track of your doctor's visits. So if you visit the webpage, you can download this and enhance your any telemedicine visits that you have upcoming. Next slide. And then we have shared this in the past, but we like to share it again. We invite you to visit thekidneyhub.org. It is a mobile-friendly web app developed by the NCC, and there is a lot of information in there that has been put together with input from patient support, or rather patient subject matter experts. The information on there is about home dialysis, the kidney transplant process, infection prevention, mental health, and more. You can save this on your home screen of your iPhone or a other mobile device, and that makes it very easy to access the information. So if you haven't already, please check it out today. Next slide. Our next COVID-19 webinar events, they are scheduled for the next provider focus event is next Wednesday, October the 28th at 3 p.m. Eastern Time. And then our patient-focused event is 2 weeks from today, November 3rd at 4 p.m. Eastern Time. So please visit kidneycovidinfocenter.com, and that's where you can register. That's where you can also keep track of all the resources that we add to the website and gain new information on a regular basis. Next slide. So we'd like to thank you all again for being with us this afternoon. Again, for additional COVID-19 resources, you can also visit the CASER website at casercoalition.com. And thank you, everyone, and have a good evening. Take care.